Thanks for joining us on Just Nigeria from the BBC and Channels TV, where we bring you the stories being talked about by the social media generation. I am Wale Fakile. Our top story this week then. Following the outbreak of the deadly coronavirus, most cities in China have been on lockdown, restricting both nationals and foreigners alike. So much has been said about this global health emergency. But just how much do you know about it? In this Explainer, Ajoke Ulotse tells us more about this virus and how Nigerians in the center of the outbreak are surviving.
You may have seen someone wearing this and wondered what it's all about. It's certainly more than dust and fumes. So, what's out there? It's spreading fast and furiously too, and giving governments all over the world sleepless nights. It all started here in China's port city of Wuhan. A few cases of a pneumonia-like infection. All patients had one thing in common: the seafood and wildlife market. It began with symptoms like high fever, dry cough, running nose and headache, and the 2019 novel coronavirus, as it's now called, has become a global health emergency, moving so fast and infecting close to 100,000 people across the world. Currently, there are thousands of Africans stranded in China. Among them are at least 60 Nigerian adults and 14 children. They are in Wuhan, the epicenter of the outbreak, with more than 20 countries evacuating their citizens from China. Some of them fear that the Nigerian government may have abandoned them.
You saw what the health minister said, that no Nigerians was willing to be evacuated. That is terrible lie. That is a lie. It is unfortunate that people are such affairs, at the time of affairs, who come out to the media, come out to the public and lie to Nigerians. How can I lie to Nigerians that no Nigerians is willing to be evacuated? So how come the sudden bring back Nigerians trapped in Wuhan?
But the government claims it has offered help and would evacuate if advised to.
The government is looking into it, and because our mission in Beijing has been providing support to those Nigerians. We have received a report from our mission in Beijing, which indicated that the Nigerians in the epicenter of the COVID virus in China are requesting for evacuation. The request has been forwarded to the appropriate authorities in Nigeria, and we are looking into that so that we can address the fears of those Nigerians, especially the students.
While returning home may seem an option, it is indeed a tough call. Here's the reality. There are growing fears that bringing back these Nigerians may spread the virus.
Those who support, please say aye. Those against, please say nay. The nays have it.
But how genuine are these concerns? Can coronavirus survive in Africa's warm temperature?
We don't have any science to prove that yet. And of course, do remember that coronavirus is only recent. It's been with us only since December last year. And we don't have any science to prove that.
If not, how prepared is Africa for a possible spread?
Because we learned a lot of lessons from the Ebola of 2014 to 2016, we have a very strong network of national public health institutes, or we'll call them sometimes national coordinating institutions, which are the bulwark of preparedness in each country. And it brings together the science, the surveillance, the laboratory, the workforce, and then they will have them managed by a director, and it's linked to us at West Africa Health Organization, WAHO.
With over 2,000 deaths recorded and people in about 30 countries infected, will the coronavirus continue to be limited to Asia and the West? This will depend largely on how ready Nigeria and the rest of the continent are.
Indeed, Nigeria needs to brace up in the face of this pandemic. We also had a chat with Professor Stanley Okolo, the Director General of West African Health Organization, WAHO, to tell us about West Africa's preparedness to contain the virus if necessary.
We have been building up a lot of this strength, not only in terms of capacity regarding skills, For example, we have nearly over 3,000 frontline epidemiologists now across the region, more than 420 advanced epidemiologists. We have network of laboratories, 12 reference laboratories. But since coronavirus started, we have massively increased this. 3 weeks ago, we had only about one or two laboratories that could test for coronavirus. As at last week, we have 5. And next week, after the training, where all our 15 countries would have laboratories where they can test for coronavirus. We have a rapid response team that is standby. The challenges that we have are challenges with, for example, if we require to quarantine large numbers of people. Once you put in rigorous management, case management, surveillance, isolation, quarantine, and then making sure that you do contact tracing, and also educating the public, and also appealing to the public, because we are the health experts, but we are appealing to the public that without them, we cannot protect them. And therefore, it's important for the public to take some inconvenience. You know about the ship that had people quarantined off Japanese coast, and there are many others. So it's just a question of that people have to go through some period of inconvenience in order to be protected.
Professor Stanley Okolo there. And still dwelling on the coronavirus,